So I first heard about AIDS in the mid-'80s, and that was when I was living on Castro Street in the San Francisco Bay Area. I didn't think I was a part of that story, except that it was devastating my neighbors. That changed in 1992 when I tested positive for HIV. My whole world just shattered, and it felt like the story of my life was wiped clean, and I had to start over this new existence as a woman living with HIV. So in 1992, we didn't have viable treatment yet. And basically when I asked my first HIV specialist, how long do I have to live, which is probably the question a lot of people ask after a diagnosis like that, he said, I don't really know. I've never actually had women living with HIV as patients. I'd only ever treated men. And he said, I'd say probably a good 5 years. And I was 28 years old, and I felt like, oh, that's it. That's the end of my life. I already had low self-esteem for a variety of reasons, partly because I'm human, and HIV just amped all of that up. I think the biggest challenge was feeling very unlovable, unworthy, and that my potential for having a family of my own, having children, for example, was just cut short. That was not going to happen. I had people tell me that you absolutely shall not ever get pregnant. If you do such a terrible thing, I will raise that kid for you if you need me to, because you're going to be dead, obviously. But there was a perception that women who had got pregnant were tantamount to murderers, because we had this not fully formed idea at that point that babies automatically had HIV and died. That is not true. We know that is not the science, but we didn't know that then. And so I felt really like I had lost my value to humanity. And so in a twisted, weird way, becoming an HIV activist gave me a purpose and made me feel like I had value. I still had something to contribute to society. When I had been involved with, or tried to be involved with, a few of the organizations that had been set up by and for gay men in San Francisco, I honestly felt like I didn't belong. And I even heard at one meeting, I will never forget, somebody saying, this is our issue as gay men. It's for us to fight because nobody else will and nobody else cares. And I was sitting there thinking, but I'm here, I care, I'm fighting for me, I also want to fight for you. But they also hadn't seen women with HIV. So I don't think they weren't intentionally trying to exclude me, but there wasn't a place yet for women in that community fight. There had been women involved with ACT UP, fighting for gay men, but that was sort of a different dynamic. Women living with HIV, not so much. Although I wish this had not been the trajectory, I think that testing positive for HIV actually snapped me into motion to try and make the diagnosis somehow of value for somebody. Even if it wasn't going to be for me, I couldn't change my own reality, but maybe I could do something so that other people would not face the same situation. I'd never seen another woman with HIV, even though obviously there were other women, but I hadn't seen that, so I started speaking in schools. It did sort of focus my life in a very unexpected way and put me on a path as an activist and an advocate for particularly women living with HIV, but for all people living with HIV. So WORLD is actually an acronym that stands for Women Organized to Respond to Life-Threatening Disease. And the woman who started that, Rebecca Dennison, really was my guiding light. And I ended up actually working for WORLD. It was a community of women living with HIV. And they did a newsletter, first and foremost, that went to women with HIV, care providers, organizations, all over the United States, and indeed all over the world. And we were very focused on things for women, for example, advocating with research projects that you're never going to have enough women enrolled in your research project if you don't offer childcare. And then they started doing retreats. I went on several retreats, and they were, to this day, remain some of the best experiences that I had as a woman with HIV, and I think that they helped me stay grounded. And Rebecca actually very quickly realized that my real interest was international work. I'd studied international relations in college. She knew that there was a great, great need for people to be speaking out, not just for women in the United States, but all over the world, because there was sort of a visibility gap, if you will. Even though half the people in the world living with HIV are women, it was perceived to be very much a gay man's disease. And so she kind of pushed me and helped me find another community, which was the International Community of Women Living with HIV. It happened to sort of coincide with the creation of UNAIDS, which is the UN program designed to focus energy on HIV, and they ended up hiring me. So I was the first openly HIV positive person hired to work at UNAIDS, and that was in 1996. I was part of a very small team of people who sort of stood up and fought until nobody could ignore us anymore. We changed the UN system a little bit from within. A very hard system to change, I might add. It is the biggest bureaucracy on the planet, but it also opened the door for other health issues. It made me very, very proud of the work, and just proud that I didn't give up on something I believed in. And it reminds me that each of us can do something, no matter how small. Each of us can do something to change the world in the right direction. I tested positive in San Francisco. Everything is available there. I live in New York. Even in New York City, it is very different. There is not a clinic dedicated to women living with HIV. There are services a woman can get, but there is not, they don't have services that are just for women with HIV. And that's in New York City, where you can get everything. If you get outside of the big cities, boy, does it change. In the rural South, which is, I believe, experiencing the worst cases of HIV now, that's where the pandemic is really sort of devastating communities. The services are not readily available. And so people living with HIV are at a deficit. They're really struggling. They can't find specialists necessarily. They don't have the same access to treatments. They don't have the same discretion. They can't go and get it safely in a way that doesn't feel like they're being exposed. So again, the stigma becomes a cofactor in living with HIV in communities where you cannot get the same healthcare services. It's a very, very real thing in this country still today. So many of my friends didn't make it. I lost count when the number of people I lost was 100. I didn't lose count. I stopped counting, and that was in 1993. And I can't even imagine if I did try to make that tally, hundreds of people all around the world who don't have the privilege to get old and see what this weird process is like. We didn't think we were going to have the luxury of getting old. And so now we're dealing with that. Oh my gosh, I am old. I find aging very confusing. Do I know how to get old anymore? Did I set up a retirement fund? Basic things like that I know, for me at least, I did not plan well for my future. Because even though I stopped believing that 5-year mark, that I was going to be dead immediately, I still didn't think it was going to last this long. And in retrospect, I probably could have done things a little bit differently, but nobody knew. Nobody knew. So we're sort of cowboys in the Western Front still trying to figure this out.